Hello and welcome back to this mini-series on emotional regulation. So today we're going to be talking about going back to our breath, all things breathing exercises. I'm going to talk you through 5 key exercises that I'd like you to give a try. So the first one is going to be box breathing. So box breathing is also known as square breathing, and it's going to involve inhaling for a set number of seconds, holding our breath for that number of seconds, exhaling and then holding again. For example, we might breathe in for 3 seconds, hold for 3 seconds, breathe out for 3 seconds, hold for 3 seconds. So as we're going in, hold, out, hold, we are creating a box in our mind, and that pattern is going to form the box that gives it its name. So the reason that this works is it's going to help us to regulate our autonomic nervous system, and it's going to activate what we call the parasympathetic nervous system, and that's going to induce relaxation. It's going to reduce our heart rate, and it's going to lower our blood pressure, and basically put us into what we call the rest and digest state rather than fight or flight. A couple of things to be aware of with this first strategy. Some individuals might find it tricky to hold their breath, so if you do have a lesser lung capacity for whatever reason, then going for 5 seconds by 5 by 5 by 5 might be a little bit too much. So just start with 2 inhale, 2 hold, 2 exhale, 2 hold. Just begin there, and then of course if you experience any discomfort or dizziness, then just stop the practice straight away, and make sure you're practicing in a safe, distraction-free environment as well, not like when you're driving or anything like that, of course. The second one then is going to be what we call 5-finger breathing, or sometimes called the hand model of breathing. So we can use our hand as a visual aid for this one. So as we move up the digit, we are going to breathe in and inhale, and then as we get to the top, we're going to hold, and as we breathe out, we're going to exhale. And of course, you can go as fast or as slow with this one as you want. This one's great with the children as well, by the way, because it's a very visual representation of our breathing. So this is going to promote what we call diaphragmatic breathing. Can never say that word. Diaphragmatic breathing. And we essentially engage in the diaphragm here and activating the relaxation response. When we are heightened, we take short, sharp, shallow breaths, just using the very top of our lungs, so to speak. Whereas when we are doing something like 5-finger breathing, we're really using the majority of our lungs and really moving our diaphragm, and that's going to help regulate our breathing pattern and reduce anxiety. Again, something to be aware of, it is going to require you or whoever's doing it to really synchronize your breath with your hand movements as you go. So of course you don't want to be rushing, you want to be really, really present with your finger moving up your digits and really sort of connect the two. And again, it's going to potentially get quite achy on your arm and your shoulder if you're doing it quite a lot, if you're breathing very, very slowly, but just a few minor considerations. The third breathing technique then is going to be called diaphragmatic breathing, or sometimes called belly breathing. This is what I used to call it with the children as well when I used to do it with them. And this is, as I said earlier, this is going to engage your diaphragm for deep breaths, and it's going to promote relaxation, and it involves expanding your belly and really filling your belly with air. So as you're breathing in, you're really thinking about breathing into the bottom of your lungs and really extending your belly and allowing it to contract as you exhale as well. So that's diaphragmatic breathing. And the way that it works again is because it activates the parasympathetic nervous system, reducing your stress and anxiety whilst increasing the oxygen intake and lowering your heart rate, because we are using more of your lung capacity there as well. And again, as always, practice when you're nice and calm. Don't try to practice for the first time in the moment of a heightened or intense emotion. It's going to feel quite unnatural initially. Ensure that you're in a really comfortable position, maybe lying down with one hand on your belly, or potentially sitting very upright in a chair like I am right now, and extending, having one hand on your belly as you breathe through. The fourth technique is called 4-7-8 breathing, sometimes called the relaxing breath. So this is how it works. We're going to breathe in for 4 seconds, hold for 7 seconds, and exhale for 8 seconds. Now that's quite a long hold and quite a long exhale. But as you're breathing in for those 4 seconds, again, try to almost engage diaphragmatic breathing. Try and breathe really deeply into your belly, so you're really getting in the air and the oxygen. And then you want to repeat that cycle. So in for 4, hold for 7, out for 8. And that's going to emphasize a longer exhale. And that longer exhale is going to be the thing that induces that relaxation. And the reason that it works, as I say, is because it extends that exhale phase, which activates the parasympathetic nervous system and releases that tension and stress, particularly from your upper body, shoulders, neck, chest sort of area. Again, if you've got any respiratory conditions or asthma or anything like that, just make sure that this is suitable for you, it's appropriate, and if you need to, of course, talk to a doctor before doing it. The fifth and final technique is what we call Nadi Shodhana, or alternate nostril breathing, basically. So what we're going to do is we're going to hold one nostril and we're going to breathe through one at a time. So we're going to breathe in and out, and then we're going to swap. In and out. Sometimes some people find it more comfortable breathing in through one and out through the other. But all it's doing is it's adding in a bit of a pause. It's making sure you're using both nostrils and kind of lengthening again the inhale and the exhale to bring down your breathing rate, heart rate, blood pressure, and activate that parasympathetic nervous system. Got it out eventually. Again, make sure you're practicing really gently. Don't sort of be forcing air out of your nose or anything like that. Start with shorter sessions and gradually increase the duration and as your sort of comfort and skill improves. So 5 breathing techniques that you can use today. Pick one, give it a go, and let me know what you think.